The following portion of Daytime is sponsored by Tampa General Hospital.
In 1985, Tampa General Hospital made medical history by performing Florida's first successful heart transplant, an extraordinary milestone that set the foundation for decades of groundbreaking innovation. Today, the TGH Transplant Institute ranks among the top 2% of all transplant centers nationwide, continuing a legacy of excellence that few programs can match. Joining us today is Dr. Benjamin Mackie. He is Vice President and Co-Chief of the TGH Heart and Vascular Institute, as well as Medical Director of Heart Transplantation. And we're going to learn about the process of heart transplantation, as well as what we can benefit from with these experienced programs and doctors. Welcome, Doctor. It's nice to have you here.
Nice to be here.
So first, would you talk us through the process? What leads somebody to need a heart transplant?
So the most common reason someone needs a heart transplant is that they have end-stage heart failure. And we would define that as someone who has heart weakness, where their heart is not able to pump enough blood to meet the demands of the body. The most common conditions that would lead to that would be coronary artery disease, so heart attacks. There's other non-heart attack related conditions such as genetic conditions or viral conditions that can lead to heart weakness. Sometimes patients have valves that leak too much or that are stuck too much together, which can also contribute to heart weakness. And then there's a number of patients that were born with heart disease that underwent multiple surgical repairs throughout life, and then into adulthood they end up with severe heart weakness and needing a transplant, and we call that adult congenital heart disease.
So would you tell us how it works when a patient needs a transplant? They have to first get on the list, correct?
Correct. So we have an evaluation process that's very comprehensive and carefully structured, and we do that to ensure that patients have optimized outcomes post-transplant. The first step is that a patient would be referred to a transplant center such as Tampa General. Our team would then evaluate that patient, and it's a multidisciplinary evaluation by multiple different specialists: comprehensive cardiac imaging and full body imaging, laboratory testing, psychosocial evaluation, and etc. Once that workup is done, the patient then is presented to our transplant selection committee, where we discuss the case again in a multidisciplinary setting and make a decision on what we think is the best therapy for the patient. And then if they are approved and waitlisted, our job really becomes to keep that patient optimized and stabilized so that they're strong enough to undergo surgery and have a successful recovery.
Since Tampa General Hospital performed that very first, which I didn't know this until today, heart transplant in Florida, what medical advancements? I mean, there must have been so many, but which ones are you most excited about?
Yeah, you know, there's been a number of transformational advances in the field that I think have really contributed to the improved outcomes we've seen in this patient population. So back in 1985, heart transplant, you can almost call it experimental. Immune suppression wasn't really figured out yet. Surgical techniques were relatively novel, and patient survival really wasn't all that great. So since that time, immune suppression has gotten much, much better. So we see far less rejection with the heart transplants and all organ transplants, I should say. The surgical techniques have been refined. Most notably, our organ preservation technology has really improved. So the way that we are able to transport and evaluate organs from donor to recipient has dramatically changed, where we can go farther away, take more time, which improves things as well. So, yeah.
Congratulations.
Thanks.
And that's a win for the patients. And so is the fact that the heart transplant program within TGH is just part of what you do. The Heart and Vascular Institute offers many more services. Would you speak to that and how that benefits our community?
Absolutely. So we have the Heart and Vascular Institute provides comprehensive cardiovascular care throughout the entire spectrum of disease. We have 28 specific programs within the Heart and Vascular Institute and 7 centers of excellence. So what that allows us to do is that we have physicians and teams with very focused world-class expertise, and we match patients with physicians and teams that care specifically for their condition. Now, all of this happens under an integrated umbrella of the Heart and Vascular Institute, which facilitates the necessary collaboration between those different specialties to care for the most complex patients. And that's really where I think the power is with the Heart and Vascular Institute. And I would also say that, as the region's leading academic medical center, our patients have access to research trials. We have a lot of ongoing innovation that our patients participate in as well, which I really think is a differentiator for the care that we're able to provide at TGH.
No question. They are in the best hands over there. Thank you, Doctor.
Thank you very much.
Always a pleasure. And if you'd like to know more about the heart transplant work being done at Tampa General Hospital, just go to this website, tgh.org/heart. We'll be right back.
The preceding portion of Daytime was sponsored by Tampa General Hospital.